welcome to Natural Talk with Angel. Thank you so much for being here with us today. Our guest today is Dr. Busquets. He is the clinic director of Primero Spine and Joint, a multidisciplinary medical clinic. Welcome, Dr. Busquets, and thank you for being here with us today.
Thank you for having me here. Appreciate it.
Not a problem. Dr. Busquets is going to be talking to us today about regenerative medicine. I'm very excited to hear more about this. I don't know anything about it, and I'm assuming most people don't, so how exciting to learn something new today. Dr. Busquets, why don't you go ahead and tell us a little bit about your practice?
Sure. Well, hi. Like I said again, thank you so much for the opportunity. So like you mentioned, we are a multidisciplinary clinic, and what that means is that we do offer more than just one specialty in the office. The whole philosophy of the office is to be able to offer people the opportunity for pain relief, right, and improve their quality of life without necessarily having medications or the dependence on medications or invasive surgeries. So nowadays, most people, when they experience chronic pain or acute pain because of bulging discs or sciatica or some kind of immune condition, things like that, usually a lot of people get just the standard cocktail medications of anti-inflammatories and painkillers. The whole idea of the office is to give them the other side, the alternatives to that. So we do it through physical therapy, chiropractic, massage therapy, some traction techniques that we do, and now through the use of regenerative medicine through stem cells.
Awesome. Go ahead. I didn't mean to cut you off. Go ahead.
So that's what the office is about. It's about giving the people an alternative to the standard, just a lot of painkillers. There's already a lot of people prescribing painkillers out there. So for those of you who do not want to depend on that, there's plenty of other choices of things that can be done.
And I think that's awesome, especially right now with all that we see going on with so many people becoming addicted to these things, and they become real issues, in their life beyond just pain anymore.
Correct. The opioid epidemic is huge.
It is. And it touches almost everybody in some form or fashion. And most people now know somebody who has an issue with that.
Right. And I see it in my office, unfortunately, every day.
That's a shame. But hopefully we've got something new here that can help. So why don't you tell us, what are stem cells and where do they come from?
So everyone has stem cells in their bodies, all the time. So we are born from a stem cell. Stem cell is basically a type of cell that can turn into a different type of cell. So what do I mean by that? So your blood cells or your heart cells, your liver cells, when they duplicate or if they multiply, they can only turn into that same type of cell. A stem cell has the ability to turn into any other type of cell and also has the ability to duplicate. So it has the ability to actually regenerate tissue because it's going to multiply, right? So where they come from, like I said, we all have stem cells. Now, as we grow, as we age, we have less stem cells in our bodies, right? So there are different types of stem cell sources for therapeutic effects, let's say. And I can dig in a little bit more into that, where they come from. But there's three main sources nowadays where people are getting stem cells for therapy. One is from your blood. They call that protein-rich plasma, or PRP. The other one, they get them from your fat cells or your bone marrow, literally. So there's an extra process where they need to be extracted from your bone marrow or your fat. They get spun around and they get re-injected. And the last one, which is really probably the most exciting because it's the potency, the ability to duplicate is way better, is from the umbilical cord of live, healthy babies, which is the umbilical cord is a piece of tissue that otherwise would have been thrown away, but it's rich on stem cells. And there's no controversy because it doesn't come from aborted fetuses or, none of that. It really comes from babies that are totally okay, from a piece of tissue that otherwise would have been just thrown away. So that's what they come.
You're repurposing it.
Absolutely, yes.
So what exactly is stem cell therapy then? Now we know what a stem cell is and where it comes from. What exactly is the therapy?
So the therapy is based on regenerating tissue or getting tissue that is damaged in your body to be good again. Okay, so for an example, humans, when they reach adulthood, we stop producing cartilage, right? When we're younger, we have the ability to actually regenerate some of the cartilage, but then there's a certain age that we stop completely. So as we age, the cartilage that we have, for example, in between your knees, or the cartilage in between your vertebrae, right, your discs, you do not have the ability to grow any more cartilage if you wear that cartilage out, right? So, for example, there's a lot of people that wear the cartilage between their knees, and it creates arthritis, and then they lead to believe that the only option is to get a knee replacement surgery, right? So stem cell therapy has the ability to actually regrow some of that cartilage back. So if you do that, then you have the potential to save somebody from a knee replacement surgery, or a hip replacement surgery, or a shoulder replacement surgery. Now, there are many applications that are in research right now when it comes to stem cell therapy. I will say that nowadays in the States, the main purpose of stem cell therapy is to regrow cartilage. But the reality is that they're able to do a lot of many other different things. I believe that in the future, the main purpose of stem cell therapy is going to help people with in autoimmune conditions, let's say like rheumatoid arthritis or psoriatic arthritis and things like that, because stem cells are attracted to damaged cells that are not working properly. So somebody with an autoimmune condition has damaged cells in their immune system that are attacking themselves. So they have the ability to actually go to those cells because they get attracted to those damaged cells. They make them better again, literally, and then they duplicate themselves, meaning like they're going to produce more of the good cells. Okay? So there's a little bit more that goes into it, but I'm trying to...
Right. We're a little short on time today, so and he does, by the way, have a seminar that will be coming up that he'll tell you about at the end, where you can go and get more in-depth answers to all your questions and see if it's something that can help you.
Absolutely.
Go ahead.
No, absolutely. Thank you.
So when you say that it will help with people that need to rebuild cartilage, I do have a gentleman that I work with who he was asking this specific question. He has a issue in one of his knees where it's literally bone on bone, that there's no more cartilage. Is this something that would help him, or do you need to have something already in there, at least a little bit, to work with?
Right. So you do need a little bit of cartilage to be able to grow that, right? Because when you inject stem cells, they're going to go to that area, but you need to have some cells that they need to attach to and regrow. Now, it is important to understand that when somebody's told that they're bone on bone, most of the time there's still some cartilage in there. You know, they probably have lost a lot of the cartilage, and I get that. So the bones could be touching each other, but most likely there's still some cartilage there. There's just a little bit. So the best thing, he needs to have an MRI to be able to see how much, cartilage, and then also it let us know where we're going to be injecting, the cells.
Right. Okay. So that was one of my next questions was, it seems like you would have to be putting the injections in the specific areas that you need it. So like if you know you have knee issues, or you know you have shoulder issues or back issues, you would know that's where you're going to be injecting it?
Correct. We are going to target the area that the person has an issue with. Now, in theory, or in once you inject it, right, it's also going to go into the blood system of the person, right? Part of it. And the stem cells are going to be attracted to whatever's damaged in their bodies. So in theory, let's say that you have your right knee is the one that is affected, but you inject them on the left knee. They're going to end up in the other knee. They're going to end up in the knee that it's bad, because they're going to be attracted to whatever's damaged in your body. Okay, the stem cells are not going to attach to good cells, only to the damaged cells. But when it goes through your blood system, they're probably going to go through other areas of your body that you might have small issues. You know, going to go through your lungs, through your heart. So they're going to be repairing things along the way. So you'll end up with less cells right in that area. So you always want to inject it in the affected area so you get the best use of those stem cells.
Right. That makes sense. That makes a lot of sense. Well, then, having talked about the injections and making sure that you get them where they need to be for the most effective, it leads me to my next question: is how often do you have to have this therapy done, or is it you do it and you're good? It's just going to start, over time reproducing itself.
Right. So that's an excellent question. It really depends. For example, something like PRP or platelet-rich plasma. If you inject from your own blood, there's not a lot of stem cells in there. There are some. So that therapy usually requires 4 to 5 injections, like 1 or 2 weeks apart. Really depends. But for example, most of what we do come from the umbilical cords. So that is really a one-time process. It's a one injection that you do, and that's it. And the injection really takes about 5 minutes to do. So most of the time is going to require just one injection, one time into the affected area, and that's it.
That's awesome.
Yeah.
Also, does it help with arthritis in the spine? That was another question I had.
Yes, absolutely. So arthritis, right? You got degeneration in the spine. Usually in the facets, which is the little joints in the back of the spine. There's going to be damaged cells in that area. So when you inject it in that area, they're going to be attracted to those, and they're going to work hard on actually making that area better. One aspect of stem cells that is important to say is that they are very anti-inflammatory, meaning it is in their nature to go into an area that is affected and immediately reduce the inflammation in that area, right? So people that have arthritis, a lot of the times they have inflammation, right, in their joints.
Yes.
You can get a benefit just by injecting them, because you're going to get a very strong anti-inflammatory response in that area. Plus, you get the regenerative aspect of them as well.
Okay.
So,
awesome. And so somebody who's had a back injury, like was in a car accident or something, had a back injury and had surgery on their back, and now the spine is has lost the, I'm sorry, I'm not a doctor, so I don't know the term for it, but the goo that goes between the
yes.
columns.
Yeah.
That will help with that as well.
It could, absolutely. The beauty of stem cells is that the concept is very simple. They're going to be anti-inflammatory, and they're going to attach to areas that are damaged, and they're going to bring them back to life, and they're going to duplicate more of that. So if you've lost some of that cartilage, some of that disc, it's going to go through them. It's going to go to them, and they're going to attach to that, and they're going to regrow that area. That's why they call it regenerative medicine, because it has actually the ability to regenerate right, to regenerate tissue. Not only cartilage. Cartilage is just happens to be the application that is being used the most now. But for example, if you have issues in a muscle, like a rotative cuff issue, right, it's going to have the ability to regrow some of that tissue that has been lost. So,
Okay.
yes.
Now, what kind of recovery time do you have for this procedure? So say that you go in and you needed that cartilage back in your knee, and you do the one injection. How long of a period before they actually start to notice or feel the difference?
So recovery-wise, to answer the first question, like recovery-wise, the beauty of it is that, for example, for something like knees and shoulders, you know, usually we recommend some light rehab afterwards. Nothing compared to, let's say, knee replacement surgery, which is going to take a lot, right, to be able to do that. So it's going to be light rehab. So usually just a couple of weeks, like 6 weeks or so, that it takes off. And so people are usually back on their feet doing their things a lot quicker. So also, hold on, I'm going to move a little bit from, in terms of, yeah, so usually the recovery times, it's a lot quicker. Now, in terms of how fast do they regenerate, it does take some time. Usually in our clinic, what we do is that we offer a new imaging, whether it's a new MRI or a new X-ray, 6 months later. Usually between 3 to 6 months after the injection, that's when you can expect to start seeing some difference in terms of growth. But you're really not going to see the full benefits. It could be a year, it could be 2 years until you see the actual full benefits of it. The beauty of it is that you are regrowing your own tissue, so it is, that tissue is there for good. It's your own tissue.
Right. Okay, that's awesome.
Yeah.
Is there any type of an age limit or an age range that is like this therapy is just not going to work for them anymore, or you need to be a certain age before?
No, if you're allowed, I mean, no, it's, now, usually the majority of the people that are using stem cell therapy are, I will say, you know, adults, obviously a little bit older, because, like I said, when you're younger, your ability to heal and recover and regenerate is stronger. So a lot of the times, the necessity is not there to do so. But as we age, because we have less stem cells in our bodies, our ability to recover from injuries and to regenerate our own tissue decreases significantly. So usually the people that are going to see the best benefits, a lot of times they're a little bit older. But really, I mean, it's not going to hurt anyone. Anybody can use it. Athletes nowadays, you know, you can hear of 20-year-olds and 30-year-old professional athletes in the NFL and things like that are doing it because it's a way to get them back on the field. But I would say, I think the majority of people, maybe 45 and above, 40, 45 and above, it's most of the times the people that are using it.
Okay. Also, real quick to touch on the insurance portion of it, is this a procedure the insurance covers, or is this more of an elective?
So unfortunately, it's considered an elective procedure, right? So like a lot of, like, let's say plastic surgery procedures that are out there, things like that. So unfortunately, it's not covered by insurance as of yet. Is it going to be covered in the future? I'm sure. That there's just no way that they'll be able to ignore it. It's growing way too fast. There's a lot of research going on right now, so I'm sure they'll pick it up at some point. But as of right now, insurance companies are not picking it up. Now, because it's more readily available, I think the prices are not as exorbitant as they used to. So it is in part to things that are other medical procedures that are cash-based out there. You know, when you get your braces done, it's going to cost you a couple $1,000, things like that. Well, this is like that too.
Okay. And then is there anything else besides the pain and the regenerating cartilage that stem cell is used for? I know that you said that you think in the future it will be used for a few other things. Is there anything currently that
So absolutely. So right now, I think musculoskeletal complaints are probably the most common uses, like you mentioned. But I think autoimmune conditions it's a big one. Like I mentioned before, rheumatoid arthritis or people with COPD, things of that nature can also see great benefits from it. There's a lot of research out there on it. If you go to scholars.google.com, you can find research papers right now on, you know, the benefits that people with rheumatoid arthritis have seen with stem cell therapy. It's done a little different. You're literally going to inject the therapy directly into the person's bloodstream, okay? And those cells are going to go straight to the, they're going to be attracted to the cells that have to do with the immune system. So I will say autoimmune conditions, it's a big one right now for stem cell therapy.
Okay, that's awesome because there's anymore it's running rampant. I hear of so much autoimmune issues out there now.
Absolutely. It's definitely a big.
Let me go ahead and let you tell everybody how they can reach out to you, where they can find you, and then also tell us a little bit about your seminar coming up.
Okay, thank you. Absolutely. So we are located, our clinic, it's located in Bartram Park Boulevard between Racetrack and Olson Augustine Road. It is, our office number is 904-299-6000. We are in the office park inside Bartram Park Boulevard. Okay, so the actual address is 13241 Bartram Park Boulevard, and we are in Suite 2501. We have an upcoming informational seminar. It's a free seminar in which we're going to talk a little bit more in detail about stem cell, and I give examples of you know, the research papers and actual cases that you can see pre and post MRIs and things like that. And it's going to happen on August 30th, you know, this month, the 30th of this month. It's at 6 p.m. from 6 to 8, with registration starting at 5:30 in Deercreek Country Club in Southside Boulevard here in Jacksonville. So again, it's August 30th, Thursday, August 30th from 6 to 8. If you guys want to register for it, you guys can literally just, you guys can give us a call at 904-299-6000. You can also email us at office@primerospineandjoint.com. And I have information on my website about stem cells as well, about regenerative medicine, but it's a little bit limited. There's a lot to it, so.
Well, what I'll also do is when we get this posted, I'll also post in there his contact information and how you can register and get you some links to his site.
Beautiful. All right.
Well, thank you so much for being with us today. That was very informative. I've learned quite a bit, and it sounds like this is going to be a new revelation, you know, a new breakthrough in healthcare.
I think so too. It's doing great, and I want to express my gratitude one more time. Thank you so much for giving me the opportunity to interview and get this out there. So
absolutely, and thank you so much for being here with us today, and thank y'all for being with us today. And we will see you next week. Bye-bye.
Bye.